Dr. Morey, Uncivilized Vitality, Anatomy, Uncivilized Anatomy. Let's keep going. Today we're going to talk about the anterolateral abdominal wall, basically your midsection between your thorax, your ribs, and down to your pelvis. Several things to talk about there. First, let's go through your anterolateral abdominal wall. Is made up of four muscles primarily. You're going to have one that runs from the sternum and the ribs down to the pubic symphysis in a longitudinal fashion. The fibers are going to run like this, and they're broken up by these little intertendinous segments into a 6 or 8 pack, and you would call this muscle your rectus abdominis. The rectus abdominis is superficial most. I'll do another video on the rectus sheath and the tendinous intersections of some of the other muscles at this very clear line that runs down between the segments of the rectus and is called the linea alba, right? Or albicans, the linea albicantes. So that line runs down the section. Your rectus abdominis is actually a right and a left independent, but they're pulled together. And there's this line through the middle, this tendon that helps divide it into that 6-pack or 8-pack. This is a line that can become separated or stretched during pregnancy and diastasis recti when those start to pull apart. And we'll talk about that a little bit later. The rectus abdominis is going to start superiorly in the pit of your stomach, or that substernal xiphoides area where your xiphoid process is at the subcostal area, right in the center line. It's going to run down your pubic symphysis. There may be some small muscles angled up here called the pyramidalis, but not everybody has that pyramidalis muscle. Now, deep to the rectus abdominis and running around the lateral part, sort of the hoop of your belly, are 3 other muscles, and they're going to go in successive layers. One, the fibers are going to run around in sort of an inferomedial angle, and this is going to be your external abdominal obliques. All right. The external obliques, and they're going to arise back here where they start with your lats and your serratus anterior up here, and the back portion, I say up here, and then the back portion of your back around your QL. They're going to run around, and the fibers are going to orient down. This will be the superficial most layer. The insertion here is going to be a sort of a tendinous insertion into the rectus sheath, which has an attachment to this linea alba in the rectus abdominis where it ties in. I'll do another video on how they tie in at a cross section, because that's kind of complicated to do here. We're just trying to keep this video quick and simple, give you an overview of to how your abdomen ties together and works. Deep to this layer on both sides, so the external abdominal obliques be coming around on both sides, the rectus would be here. You're going to have fibers that are going to run from the costal cartilage and the iliac crest, and they're going to run fibers in coming around like this and inserting on your rectus sheath. And then, like I said, where they originate. And this is going to be your internal abdominal obliquus. So your internal abdominal obliques. The fibers are going to run perpendicular to each other. One of the ways to remember that is when you're outside, you put your fingers in your pockets so they stay warm. So outside, external, and the fibers run down like your fingers do when they're in your pocket. The internal obliques run upward. So like when you're doing self-reflection or internal contemplation, in prayer maybe, your fingers run upward. Just the way I learned it and remembered it. So internal abdominal oblique, the fiber is going to run superomedially, and the external obliques, the superficial set, is going to run inferomedially, and they're both going to insert on the rectus sheath. The IAO is going to originate from the upper 6 or so costal cartilage and the iliac crest, and then it comes around and inserts into that rectus sheath and the linea albicans, and the linea semilunaris, which is the name of that tendinous sort of outside line on the rectus sheath. And then the external obliques are going to originate from serratus anterior and my lats and my low back aponeuroses in my low back and come around in that inferior medial direction. Now, deep to those, so superficial, next layer down, sort of off to the side laterally, next layer down, just deep to that. The deepest layer is going to be a muscle called the transverse abdominis, because its fibers run in a transverse abdominis, in a transverse orientation. And again, these would be coming from your iliac crest and a little bit under the costal cartilage, and they're going to insert, it's going to insert along the rectus abdominis, on the rectus sheath, on the deep surface of that. I'll do another video on the rectus sheath, like a 5 or 6 minute supplemental video to this video to explain that. So those are the 4 muscles that make up your anterolateral abdominal wall. Rectus, abdominis in the middle, then you get your external obliques either side, superficial to the internal oblique, which is superficial to the transverse abdominis. Now, if you take all 4 of those muscles and the skin and a couple other layers, your abdominal wall looks like this from the side view. Well, actually, we'll go superficial to deep. So superficial to deep. We'll go in this way. Now, obviously, you have your viscera. Okay? The viscera are your organs that are inside your abdominal cavity. Just superficial to the viscera is the peritoneum. Okay? The peritoneum is one of the 3 major serous membranes in your body, and it's going to be composed of that's obviously not drawn like this to scale, it's going to be composed of 2 parts. Like any serous membrane has 2 parts. It's got the visceral layer, which is close to the viscera, and you've got the parietal layer, which would be the superficial layer of the serous membrane. Usually a potential space between the 2, some serous fluid so it can move about. Just superficial to the parietal layer of the peritoneum, you're going to find extraperitoneal fat layer. Extraperitoneal fat layer. Kind of a membranous, or a fatty layer where you get some infiltration in the muscles. If you're a big bacon fan, this would be the white parts between those strips of meat on bacon. Bacon is thin strips of the abdominal muscle with that extraperitoneal fat, and then the muscles layered between it. You can think about that for a while. Then you're going to have the muscles. You're going to have your TA, your internal abdominal oblique, your external abdominal oblique. And again, depending on where you're at, if you're taking a section on the lateral 45 degree, you're not going to get this next layer, which would be the transverse abdominis. We could just refer to that as the muscle layer, right? Muscles. So you got peritoneum made up of two layers. Extraperitoneal membranous layer, sometimes containing fat, superficial to that. Then you're going to go through your muscles, and then you're going to have 2 other layers. You're going to have a membranous, kind of a tough layer. Think of that as superficial muscular fascia that's specialized a little bit, and this will be your Camper's fascia. That's your membranous layer. All right, so the membranous connective tissue layer. Superficial to that, you're going to have a fatty connective tissue layer, and this is the one that gets really thick. This is where we store our abdominal fat or any subcutaneous fat. You can think of these 2. I think this one is Scarpa's. Now, I may have Camper's and Scarpa's layers interchanged, but I'm not a big fan of eponyms, so you can ignore that. Think of the membranous layer closest to the muscle, and the fatty layer is superficial to that, because this is your subcutaneous layer composed of those 2 sections, and then you get your skin. Right? So you get from superficial to deep skin, then you're going to get your subcutaneous tissue made up of the fatty layer, and then deep to that is the membranous layer. That's your subcutaneous. That's where you store a lot of your fat, right below the skin. It's metabolically very active. It's super helpful to have it there for lots of reasons. Then you go down deep, you go through your muscle, depending on where your section is, you get through all 4 or just 3 of the muscular layers. Don't forget, each muscle has corresponding superficial and deep superficial muscular fascia. Okay, so there's fascial layers between that to surround and bind the muscles that they can slide on. Then you're going to find an extraperitoneal layer. It's kind of fatty. The double-walled serous membrane called the peritoneum. Then you're going to get down to the viscera. The posterior wall of the abdomen is made up of your psoas major and your quadratus lumborum muscles, and of course your vertebral column. So we'll talk about the posterior wall when we do, I'll get to that in another video. So those are the layers. We talked about the muscles a little bit. That's kind of what makes up your anterolateral abdominal wall. If you like this one, leave a thumbs up in the comment, and then stay tuned. I'll do the second one. We'll go over different regions, superficial or surface anatomy of the abdomen, and it's vascular, so supply. We should probably do that too.